Well, welcome back. We're answering your questions about COVID-19 with Cone Health's Infection Prevention Medical Director, Dr. Cynthia Snyder. So why does Cone Health still have visitation restrictions in place?
So like many other health systems, we screen not only all our employees, but our visitors who come in. And we still are keeping our age limitation of 18 and up. In part, it has a lot to do with the fact that we are still concerned that there is a lot of COVID in the community, and especially in populations that are not as fully vaccinated as others.
Okay. This question is, if we need a booster, and I've taken J&J, can I take Pfizer instead?
I think that's a fantastic question. We've had quite a few other folks who may have gotten one vaccine at one time accidentally or purposely gotten a different one for their second dose and have tolerated it okay. We still don't know at this time if we need to have a booster vaccine. And I believe more information will come through the CDC and the Biden administration in the coming months as they evaluate more of the scientific data coming out of Pfizer and Moderna.
All right, and then we can see if we do need to take that and if they will allow us to jump over and do that. Okay, this person says, I don't want Johnson & Johnson. Of the other two, which would be the Pfizer or the Moderna, which one has less side effects?
If you look at it as a whole, they have very comparable side effects. And some people have reported more side effects on the first dose of Moderna and less so on their second dose, and then the vice versa for Pfizer. And then also, it's really dependent on your age and maybe some of your health problems. Some people tolerate it without an issue, and then a few people just have fatigue and a little bit of chills for about a day and a half and are fine. Mm-hmm. For the most part, it's very well tolerated.
This question is, are we reopening things too soon with this Delta variant spreading?
I want to say that I'm tend to be cautious in certain scenarios. I believe it's still worth wearing a mask indoors in large settings, especially if you don't know what people's vaccine status is. So, still going at the grocery store, I think the more conservative approach is to wear a mask, even if you're vaccinated. You don't necessarily have to, but I think it's safe. And especially if folks are starting to attend church or any other large gatherings in person, it's still worth wearing the mask.
Mm-hmm. All right, this person is saying, how likely are people who have been vaccinated at risk of getting that Delta strain?
The numbers are very low. In our health system, we have had less than, I think, 40 cases, and a majority of only, I'm trying to think, about 5 or 6 cases were people who were symptomatic enough to be hospitalized. And a majority of folks are very minimally symptomatic or asymptomatic. I think the rates are still very, very low. It is an incredibly effective vaccine, right? You want to make sure that you yourself don't get hospitalized from it or have severe disease, and that's the great impact about these vaccines. And we also know that the viral load right now is very low to be able to transmit to others. And that was like the question we were worried about. We still don't know to that effect when viruses mutate so much that they could overcome the mechanism of the vaccine. But for right now, we feel that it is very effective, and that's the best tool we have in preventing it spreading into our community too much.
This person is asking, what is a safe time to get the vaccine after you've had COVID?
So, we feel that after COVID, you do have quite a bit of immunity for at least 3 months. But especially with the variant coming into our community, if you are feeling well and you can start getting your vaccine even like a month after you recovered.
This person says, my son is 13 and obese. He has ADD and asthma, and I'm concerned about him getting an enlarged heart with the issues that other young men seem to be having. What are the chances of him getting this? What kinds of things should I be thinking about with this vaccine?
That's also a very good question. They have found some cases with pericarditis, that's an inflammation of the heart muscle, and we see that with COVID, in cases of COVID, and we see that with other respiratory illnesses. When they looked at all the cases that were reported associated with a vaccine, it is still much, much lower than the cases in general. So, given that concern about your son being young, he has a couple risk factors for having severe disease, specifically asthma. And so I think it's worth still getting the vaccine. I believe the rates are exceptionally low. If I were in that position, I would definitely vaccinate my kid.
Okay. All right, we're going to take a quick break, but we're taking your text questions in the next segment as well. You can continue to text. We'll be right back.